The nurse quality consultant is at a large 1,400 bed hospital, and they had recognized a significant challenge related to falls and falls with injury, both. Specifically focused during this time period on our inpatient units. This project ended up to be roughly 24 weeks in length. And during that time frame, we were able to roll out on all of the units a standardized approach, universal fall protocol for all of our patients, and making sure that the same things were done across the entire building. On our assessment when we initially started this project, so this was a transitional leadership project, which starts with an assessment for the first week. During that assessment, we discovered 11 different fall signs across the house that were being used. So inconsistent use of messaging, inconsistent use of communication. Also recognized that there was not standard understanding of the interventions that should be put in place based on the assessment scores that they were doing for their falls. With the size of this hospital, getting everybody on the same page and engaged in the work and doing the same things was really instrumental to be able to get some success as a whole campus. We did do 2 phases. The initial group was the first 17 weeks, and we rolled out across 8 units the universal fall protocol. This was done very slowly, and we had staff engaged in this. We had both a implementation team, and we also had a stakeholder team. And we really wanted frontline staff. So we had patient care techs, we had PTAs, we had physical therapists, we had nurses across the entire group of units that we were going to be working with on the implementation team. But then for the stakeholder team, we had leaders from across the entire hospital to make sure that whatever we built, they could agree to and buy into having success on. We also implemented not just fall huddles, but event debriefs where we were really getting into the root cause. This was a teaching event for the people involved because they really struggled with identifying what the root cause of the fall was. And that took some practice. I'm going to say implemented it with the first pilot units and then across the house following that in the second 17 weeks. As you look at the work that we did month over month, and specifically looking at the first 17 weeks with our pilot unit that we did initially, we had set to have a goal of 5% reduction in falls for the month of October, another 5% in November, and a further 10% in December. And for our implementation units, we actually had a decrease above goal. I'll just say overall fourth quarter, the percentile of improvement was 21% improvement for all of those units overall for the fourth quarter, with a 32% improvement in November, losing a little bit of ground in December related to some holidays and less validation is what we discovered there. However, our falls with injury also decreased significantly the first month, seeing a 35% decrease, and the second month an additional 24% decrease in falls with injury. And we were on target to have the lowest fall rate in April when our project ended. So believing that they were going to continue a significant decrease in the number of falls with injury specifically. So a lot of really strong work, a lot of consistent practices that were put in place. So what ended up happening is that just a month into the second 17 weeks of this project, they recognized the need to have a permanent position in this role, and the position was posted and the person started in the role, so that the last month that our leader was on site, they helped to onboard the person that was going to be the permanent person doing this quality work. So it's always a good sign when we see that there's enough improvement and enough solid commitment that this has been helpful and that this was successful, that they end up hiring a permanent person to continue to do the work on an ongoing basis. So very happy with this work.